I want to take a moment here to thank you and to welcome you to this session organized by Dental Monitoring. My name is Rayan Skafi. I'm a dentist and a clinical education officer at Dental Monitoring, where I spend most of my time in research, education, and working closely with high caliber key opinion leaders, such as the speakers that are beside me here today, to keep developing innovative technologies to take the dental profession to the next level. And this is what the discussion of today is all about. The discussion of today will revolve around the virtual world of dentistry, which is without any doubt the next milestone in innovation. In the past few decades, we've seen the dental industry evolve at a rapid pace, moving from analog to digital, allowing dental professionals to increase their efficiency and provide a higher level of care. The next evolution involves moving towards virtual. So in this session, we'll talk about how patient empowerment and technological development like artificial intelligence and teledentistry made that space for the delocalization of patient care and why it is necessary to quickly adapt to stay ahead of the game. So some of the main questions that we will touch on today are the following. In what orthodontic cases can the remote monitoring be applied? What is the impact on the quality of the treatment and the workflow? What is the impact on the patient journey? How is it perceived by patients? And what are the team's requirements to make it work in your practice? So to answer these questions and many more, of course, I'm honored to be surrounded by a panel of experts that come from different backgrounds and with different experiences. The diversity that we have here today is crucial to answer all of your questions, no matter who you are and what level of experience you have. Whether you're a specialist orthodontist, a GP, an associate, or even a staff member, we got you covered. Dr. Anshu Sood, Murtuza Hasnaini, Martina, Hodgson, and Keely Thorne, welcome. What an absolute pleasure to have you on this panel.
Thank you.
Thank you.
So I want to start this discussion by asking a very general question that might be on many of the listeners' minds, since I can imagine that a lot of you are new to this concept. And the first question is for you, Murtuza. Murtuza, I've known you for quite some time now, and I know that you are someone who is tech savvy, who is an innovator, and an early adopter of disruptive technologies. I also know that you follow a lot the world of medicine, what's going on around us, which is smart actually, because they're always one step ahead of us. And so we have to learn from them and learn from their mistakes. And the best example that you often talk about is telemedicine, which existed for many decades. Unlike teledentistry, which has existed before, but was never extensively used until recently in the context of the sanitary crisis. But you started this way before this started to become a hype. So my question to you is the following. The first time you heard about the concept of remote monitoring in dentistry a few years ago, was it obvious to you? Did you anticipate the benefits from the beginning, or did you really stumble upon the answers later on during your adoption journey?
Well, Ryan, I think the answer is a bit of both, really. As you say, telemedicine has been around for such a long time, and there was an element of frustration here as to why a similar concept didn't really exist for dentistry. I guess some of us were looking for that solution well before COVID hit us. So I think when I came across dental monitoring, it was pretty obvious that there was something very revolutionary here that we could make use of. And then, of course, when you start using that technology, you really start to learn more about it. You learn from your own mistakes, the pitfalls, you create your own systems, and then you really start to see, the benefits on a completely different level. And I think what we found is that over the last, now it's coming up to 3 years that we've been using dental monitoring, it's just been a revolution, and our practice has changed. It's almost like taking my practice, shaking it around and turning it upside down, and that's essentially what dental monitoring has done. So I think we knew what it had in terms of potential, but we really have realized it a couple of years onwards now.
That's awesome. And that takes me actually to the next question, the big debate, the chicken or the egg. Some people, they say they have to wait until they grow enough, they have enough cases to start implementing these new technologies, because at the end of the day, it is kind of an investment. And when you invest into something new, you always think about the return on investment, the benefit that you can get for yourself and your practice. And some other people, they believe that it is crucial to invest in new technologies in order to help you grow your cases. Which one are you, Murtuza, and what do you think about this one?
Well, I think, you've got to invest in anything that you do in dentistry. We all know that, and the more you invest, the better you get, whether it's your clinical skills or otherwise. And I think to look at dental monitoring and say, well, look, let me get a certain number of cases or get to a certain point, and then I'll take it on. I think it's the wrong way around, really. I think we very much took the approach that we saw the potential and we dived into it and very much thought, well, let's just get a cutoff point after which every single patient becomes a dental monitoring patient. To be fair, I didn't take some of my existing patients into it. Any new case starts that came in, everybody went into dental monitoring. And looking back on it, I mean, that was the right way of doing it. And we're now almost 100%. I mean, there are no patients practically in my practice now that don't use dental monitoring. And the change and the investment and the return on investment is just phenomenal. So I think it very much is looking at this and saying, we had no choice during COVID. So that was a big impetus to do it. But even prior to that, the right attitude was just to jump in and go for it.
That's awesome. Martina, I have one question for you. I saw on your social media page recently you hit the top 1% as an aligner provider. So first of all, congratulations for that. And the second of all, you reach such a huge milestone in your career in such a short time. So you obviously have something to say here. What kind of advice would you give for the listener?
In terms of, getting to diamond quickly, it takes a lot of hard work, but it's all about your teamwork, really, and it's about building a team around you and building systems and building processes in place that is really going to propel you forwards and streamline everything, making everything really slick. But the number one thing that you need to do is you need to give your patients an amazing experience. You need, from the first minute that they contact the practice to the end result where you're finally revealing their smile for the first time, they need to be absolutely wowed. And if you're giving them that service, it's just going to build really quickly because you'll get a lot of word of mouth. And if you care about what you do, if you're passionate about what you do, you'll get better and better and better at it. And to me, that's the way that you're going to build your practice.
So the staff is absolutely key to your success. But I also want to quote you on something that you often say, and I really love this one. You say, before spending a penny on marketing, you have to absolutely nail your journey. And, there are many different pieces to this puzzle. And the most important one is probably, as you said right now, the staff and the delegation. They're the key to a successful patient journey. But, I mean, maybe you were lucky in some way to have a staff that is really flexible, really accepting of what's coming in their way, and they love the challenges. They're people like you. But what is your advice to most dentists that are afraid that their team will be kind of resistant to that change? What if their team will say, this will give me extra work? Does this mean that I have to learn new skills? What if I'm not tech savvy? So how did your team receive this? And what is your advice for all the other staff?
So I think it's really interesting what you said there, that I'm really lucky to have the staff that I do, and maybe I'm lucky, or maybe I chose them very carefully.
Shout out to Tracy.
Specifically, Tracy. Now, all of them are amazing.
Of course, but I only know Tracy.
Yeah, Tracy's my treatment coordinator, and she's kind of been with me on the whole journey that we've had with Invisalign from the very start. So we built our journey together. And we put a lot of hard work, we put a lot of soul and passion into that. But, it starts with your team, and it's the absolute hardest part of it is making sure that you've got the right team, making sure that you've got the right people in the right roles. And that's the hardest thing, because if you haven't got people on board, you can push and push and push, but they will pull back and you won't go anywhere. So it's about building a team around you that are aligned with your vision, that are excited by the same goals that you are. And that doesn't come easy. I'm not going to sugarcoat it. It doesn't come easy. It's hard work. But when you get that team, oh my God, that is when the magic happens. And, right from our lead ninja, I call her Jess, who's our new patient coordinator, and she deals with all the calls. And she is the most important person in our practice because she is the front line. She is the one that, makes or breaks it for that first patient contact, through to the treatment coordinator, free consultations with Tracy, down to me. I'm right at the bottom of the pile. I'm the least important person in my practice because they all come before me. And if you can get that patient journey nailed, and they like I say, they're aligned with your vision, then it's really exciting because we all made this push for Diamond this month, and we achieved it. And Tracy did a little TikTok dance, and it's exciting and it's fun. And you've got to have them on board. And if they're not on board, sometimes you have tough decisions to make.
That's absolutely amazing, Martina. Congratulations once again. One little question on what you said right now. You said something really interesting and important and might not be obvious to everyone. The front line, the lead ninja, or some people like to call it the new patient coordinator. Can you very simply explain to us what does that role mean?
It's such an important role in our practice, and it was kind of the biggest step that I took, and I would say it was the most nerve-wracking step because I employed someone full-time just to look after and nurture my new patients. So from however that lead comes in, whether they come from social media or whether they come from Google ads or Facebook ads, however they come in, it's her role to contact that patient, to build rapport with that patient, to educate and consent that patient. And we actually built her a room. She has her own room off of reception. And you know what? That girl loves to talk. And the feedback we get from our patients is just incredible. And you see her and chill and she's chatting away, and they love it because she has not got a queue of patients. She's not got patients banging on the front door because it's locked because of COVID. She can relax. She can give that patient the one-to-one, that they need, and that is when you wow your patient from that very first contact, and they ain't going to go anywhere else after that.
Yes. That's just awesome. Now, when we talk about patient experience, there's one name that comes to mind, Anshu Sood. So, Anshu, I have one question for you. This system obviously gives you, as a doctor, a high level of convenience, being able to have significant amount of unnecessary in-office appointments, and especially when we talk about aligners. It also allows you to generate a significant amount of leads and so on. But as I mentioned earlier in my introduction, we live in the era of patient empowerment. It's all about them and not us anymore. So in that context, a lot of doctors might be worried that this will not be accepted by patients, as they might feel less reassured because they'd rather see you in person, because after all, it's the way it's always been. And also some patients might not be tech savvy and might say, no way I can do that. It's just not for me. And some might see this as an extra cost. Some might be worried about their data, which is today one hot big topic. So what does your experience have to say about that?
Well, I think you're absolutely right. It's a really good point, isn't it? Because as clinicians, when we invest in new technology, we nearly always think about how it will benefit us. And obviously we think about the patient journey, but we never really fully understand the impact that it would have on them until we get started with things. And so certainly that was one of my worries. And like Martina has said before, I think getting the team on board with the right kind of vision and scripting behind it is really, really important. For the patients themselves, I think we had started, like Murtuza had said, where we'd started all of our new patients on the dental monitoring journey, and then suddenly COVID hit and we were pushed to sort of put everybody on there. And that really accelerated our growth, but it really, really made patients understand how concerned and how clear we were about the fact that we were happy to keep monitoring their treatment even when they couldn't come into the practice. And so going back to your question, one of the things we always like to say to patients is that you might want to see us every 6 to 8 weeks, but actually we want to see your teeth every week. And so that's why we invest in this technology. That's why we invest in asking you to take the scans and teaching you how to use the scan boxes, because seeing you every 6 to 8 weeks, whilst it's nice for you to see us, it's not enough for us seeing your teeth. And so certainly we've moved on to being very positive about the language that we use around it to reassure patients that there is a benefit in them doing that. And there are some people that are concerned about the GDPR, the HIPAA kind of things about it, but we know we're reassured that that's all safe. We know that you guys take care of their data. We know that it's all stored in a cloud. We know that it can all be accessed retrospectively if we needed it for any reason. And so we are able to pass those reassurances on to patients as well. And certainly we do have patients that are maybe not as tech savvy as others, and they're not necessarily the ones that you always assume. And so we've gone one step further, and as well as having the treatment coordinators that Martina speaks about, we actually have a patient care coordinator who is somebody who looks after the patient once their journey starts and sees them through that. So our patient care coordinator, Maxine, she will be the one that is on the end of the phone if people can't manage to go on with their scan boxes, if they struggle at all, if they're not managing to scan. And of course, for those of you that aren't using dental monitoring, you might not know, but if patients aren't scanning, we do get told, so we can pick up the phone and we can be in touch with those patients and say, you know, what is it that you're struggling with? Because we really, really want to see how your progress is going. You will really see the value in seeing the little video that turns up to see each time you scan, how your teeth morph into your new smile. And so how can we help you get on board with that process? What can we do to make it easy for you to start scanning? And often it's just making people understand the value of it. Sometimes it is problems with the actual scans, but it very rarely is that. And so I think the patient onboarding experience is really, really important. And it is time well spent at the beginning of the treatment when you deliver their aligners or their fixed braces, whenever they start treatment, to get them moving along that journey.
That's absolutely amazing. So what you have seen in your experience is that the acceptance rate is actually pretty high.
We don't have a problem with that at all, to be quite honest. There'll be one or two patients that just don't want to do it, and after a little bit of conversation, we sometimes bring them back into the practice. We ask them to bring their scan boxes with them. Maxine sits down with them and she goes through everything again. We very rarely get to the stage where people don't understand the value of it. And certainly I think that the whole concept around keeping them COVID safe, not asking them to come into the practice unless it's really necessary, being able to see them on their journey every week rather than waiting for a problem to just turn up at their next planned appointment, it makes people understand how much more efficient their treatment can be, how we can sort of come up against those hurdles as they come rather than waiting for them to present themselves in the clinic next time. And it really makes patients understand that actually we're keeping an eye on them every week. That is above and beyond any service that they would get from any other practice who wasn't using that kind of a system. And so, yes, finally, like you say, I think it's really easy to get patients on board when they understand the value of it and the team understand how to deliver that message.
I just love how much emphasis you put on the perceived value of the patient. And so now I want to take the discussion in a maybe slightly different direction and tap into the psychology of the patient and psychology of acceptance. Because when people ask me, what is so important about the process of scanning your teeth every month and how does that because we always say that can impact in such a positive way the compliance rate of the patient. And some people, they don't understand how does that affect the compliance rate. And the analogy that I always use is Weight Watchers. Today, Weight Watchers, they are number one in the world when it comes to compliance with their clients. What do? They do personalized messages, they do weekly monitoring, and they do milestones. And with dental monitoring, with the scanning process, with the feedback that you can get as a patient, it's absolutely the same thing. So what I want to ask you is, have you seen any impact, and especially when we talk about teens, for example, because the rebels one. So have you noticed that you have more compliance rate? And then maybe let's talk about compliance and talk about treatment adherence here.
So I think we all have experienced that kind of concept whereby people come in and they start brace treatment and they have never paid so much attention to their teeth as they have done before. And so suddenly they'll turn up and they'll be like, oh, I've got this little brown mark I've never noticed on my teeth before. And you look at your start photos and it's been there ever since the beginning, and they've never actually been that engaged with the process. And we found that dental monitoring has actually taken that one step further. And with the direct messaging, we find that people are actually very engaged with their treatment, very concerned about how it's going on. If we don't, manage to respond really super quickly, they're thinking, is everything okay? Can you just let me know? And so actually, I think patients are more engaged than ever when we use dental monitoring, because they understand that they have access to us, just like we are asking them to show us their teeth. They understand that they have access to us. They don't have to wait to that planned appointment to bring up any concerns that they've got, to raise any queries they might have. And so definitely the minute they notice, we send them messages about poor oral hygiene, loss of attachments, wires out of brackets. And so all of those things that dental monitoring is able to pick up, patients understand that we are keeping an eye on them. They are making themselves accountable, like the Weight Watchers thing. You say, at the end of the day, every week people do a weigh-in, don't they, on Weight Watchers? They are being accountable for their treatment. So compliance definitely goes up. Acceptance of it once people are on board, the scanning process goes up. And certainly we are definitely seeing efficiencies in treatment duration as well, because we are heading off any problems as soon as they happen. And in the same way as well, we are progressing the treatment much more quickly than we would be if we were necessarily just waiting for standard appointment intervals. So I think it works for both of those items.
That's just amazing. And if people were more interested about this concept, which I find is really interesting, some recent surveys, they say that approximately 90% of patients, they believe that using an interactive application with their health provider, especially dentists, can increase their oral hygiene and can increase their, patients, their well-being when it comes to mouth health. Now, I wanted to ask you one last question, Anshu. Usually when you receive the scans from patients,
mm-hmm.
do you find that the quality of the scan is good enough for you to be able to make clinical decisions? And yeah.
So absolutely. We've never had scans that are not good enough to make clinical decisions, but we have had patients where we know their scans could be better. So I think that's the same thing again. It's just about the onboarding process. It's about making patients understand what needs to happen. So I think sometimes patients are worried that when they do it, they take scans with their aligners out and then they just pop their aligners in. And so we've kind of got into the habit of little simple things. So when you put your aligners in, make sure they're fully seated before you take your scan, because otherwise it's going to show you a false result that your aligners don't fit properly. It's really simple things that patients don't necessarily think of, but are really obvious to us. So certainly I've noticed we've started pre-scan box using dental monitoring, and then obviously we've moved on to the scan boxes. And the use of the scan boxes has definitely increased the quality of the scans and the photographs that we're getting. I think it's important that you make sure that you pick the right size retractors, because I think that was a mistake we made early on, where we'd maybe picked ones that were slightly too big, and so people were struggling to get them around the buccal segments. But all of those things can be overcome just by talking to people like us, who've done it before, rather than you reinventing the wheel. And we do a lot of prescriptions. We do a lot of monitoring off the scans themselves, like you said, to just monitor patient progress and then decide when the next interval for the face-to-face appointment needs to be. So yes, definitely good quality photos and scans.
Perfect. I'll add two things to what you just said, Anshu. And this is the importance of the artificial intelligence when we talk about taking pictures and scans. If the patient take a scan and the quality is not good enough, to avoid wasting some time, the AI will do a preliminary assessment and will detect that the quality is not good enough and will prompt the patient right on spot to take another scan. So that's the difference of, using something that is AI powered and something that is just basically taking a picture and sending it to a platform. The second thing that I want to add, you mentioned data protection, Anshu, and I just want to say to everyone that at Dental Monitoring, we are HIPAA and GDPR compliant. So we have hit the highest standard when it comes to data protection. And so there's no concern whatsoever when we talk about this. Now I want to move to a different word, and I want to ask you, Dr. Keely Thorne, who is today an associate. And what's hard about the word of associate is that you, Keely, belong to a very small minority, I would say, that is super ambitious and super ahead of the curve. And you want to be able to use this technology, whether the practice owner is starting to use it or not. So what I want to ask you is, how would you justify the cost when you're trying to convince the practice owner that this is a good technology for his practice? And how can you tell it? He might be asking himself, is it worth the trouble and the price? How do you respond to that?
So I really see dental monitoring as a bit of self-investment, really. I have in the past been quite reliant on my practice and kind of feeling quite limited with the opportunities that I've had because of the things that were not being done for me in the practice, basically. So now I try really to invest in myself more and take control of situations myself, give myself the opportunities. And that's how I see things like dental monitoring, getting my own materials, investing with courses and things like that. So I'm a really big believer in that. I think it's really, really important. But on a just purely financial level, if you were an associate and you were thinking that this is the kind of service that you wanted to offer, but perhaps your principal doesn't quite see the value in it, you haven't got that support, just purely financially, if you were to invest yourself and you were to cover 100% of that lab fee, you would still be financially better off because of the amount of time that it would save you of your clinical time. So I'm in 2 separate practices, and in one practice I do get the help with the lab fee, and in the other practice I don't, but I still use monitoring in both of those practices because I really know that financially alone it's beneficial for me because of that time that I'm saving, but there is also loads of other benefits as well. So my cases have started to really rise since I've been using monitoring. And it's not just because of that extra capacity that I have in my diary, it's because there are loads of other benefits as well. Things that Martina and Anshu already said, patient compliance. My patients are so much more compliant now. They're not, I'm not having that stress that I used to have, worrying about that. But also patients really feel like they're getting a better experience. So it's like what Martina was saying, that you give your patients a really good experience and they're going to refer you, they're going to want to tell other people about you. And patients who are being monitored, they know that they're being looked after weekly rather than monthly. They think that the technology is really cool. You know, they know that it's sort of a really high level of service that they're being offered. They appreciate not having to take time out of work to travel into the practice. You know, they're not having to get childcare and things like that. So they're all reasons to sort of sing your praises to their friends and family and to recommend you. So I am finding I'm getting a lot more word of mouth referrals. I'm getting better, nice reviews written about me. And overall, my relationship with my patients, I think, has really, really improved because they get that weekly feedback from you. And so they do definitely feel a little bit more better looked after. But then, as I said, there's also the fact that patients are being more compliant now. And what I find is that I'm far less stressed than I was before, because when my Invisalign cases started to increase, I started to feel a bit like, oh my gosh, I've got all of these patients now going through these long treatments and I need to keep track of them all and know where they're at. And a lot of them would contact the practice rather than me, so I wouldn't know fully what was going on. Whereas now I feel really in control of all of my patients. I know exactly what's going on. I've got an app on my phone where I can see which aligner they're on, you know, how well their how their progress is going weekly. I've got obviously all of the pictures of that. So I am feeling a lot more in control and organised and less stressed. And I think that in itself is worth every penny. But overall, I'd say, yes, if you are an associate and you are thinking about investing in the service yourself, and if you don't have that support from your practice, I would say you will be a huge gain for investing in it just yourself. It's a bonus if then you can get your principal on board and to start helping out with, you know, the lab fees and things like that. But either way, you'll be in a really good position.
That's really inspirational, Keely. So that was really a leap of faith that you took, I think maybe 1 year ago, and you were so happy to do it, right?
Yeah, it's been the best thing that I've done. And I actually did, when I started with monitoring, I did actually wait until my cases built a little, because I thought, oh, well, I don't want to invest in it right now until I need to, because I'm at sort of maximum capacity to free up my diary. Whereas, and it's like you guys have already said, it actually it grows you, it gets you more patients, it causes you to get more cases because of the fact that it is this better service and people are talking about it and referring you. So actually I look back and think, I wish now that I'd have got it sooner and not waited, because I could have been, doing even more now.
That's just awesome. You were actually able to grow your own little world within the world of the practice, right? And that made such a big difference between you and all the other associates that were not investing in themselves like you did.
Yeah, well, I think actually that's the thing. It's thinking about building yourself so that you will have your own success, that regardless of the practice that you're in, you'll take it with you, because it's you that patients are coming to see. And I think that's really, really important.
Absolutely fantastic. Thank you, Keely. Murtuza, I want to go back to you now. So far, we talk about aligners, and obviously there is such a huge advantage of using this technology to remotely monitor your aligner patient to tell them if they're ready to move on to the next one or not, if everything is fitting properly or not. Now, one thing that we didn't touch on is the word of fixed appliances, braces and other fixed appliances.
Sure.
And, a few months ago, I was trying to understand from you do you really benefit from this? And I asked you, make it simple for me, Murtuza. If I'm, a 15-year-old boy called Mark doing a braces treatment, how does that change my journey? And how do you use this remote monitoring system to track to manage my treatment?
Well, about 2 years ago, we started every single one of our braces cases going into dental monitoring as well. So in my practice now, there really is no exception. Everybody has dental monitoring, so we don't really distinguish between braces or Invisalign. I think that's the first point. There is no mindset change that, oh, your braces, you're Invisalign, so you have it and you don't have it. The practice is dental monitoring, and there really is no other choice. And all patients have dental monitoring. So I think that's the first part to this, that the mindset is there that we just use dental monitoring. I think the advantages for braces are just as many as Invisalign. We can see those teeth moving in front of our eyes. Historically, when we were learning our orthodontic training, we'd see those patients every couple of months, and we'd just change those wires. With the 3D program that comes with the braces side of things, we can actually see for example, when the wire becomes passive and those teeth have stopped moving. So really, we are bringing that patient in at the correct interval rather than a guesstimated interval. And that was something that was so revolutionary to me, because when we trained as postgrads, we brought the patients in when our teachers taught us to, whereas now we bring the patients in when the wire has done its work. So I think that has been a phenomenal change. And for that 15-year-old, he's going to be very tech savvy anyway. So for him to be able to know that his doctor is actually seeing him every single week. If his brace breaks, then we know before him that his brace is broken, and we get him in and get it sorted for him before that tooth moves out of place or before the wire bothers him. So I guess it's been like no different to the other presenters, that we looked at the braces program as just an integral part of our practice, just as much as the Invisalign side of it.
And so, in terms of appointments, how did that change the game?
Well, I mean, it's such a game changer that it's almost very hard to quantify. We're probably looking at around about a 50% reduction in appointments on a typical braces case. So we would historically have seen patients every 8 weeks. Now we're seeing patients perhaps every 12 to 16 weeks. So if you take that across a 2-year treatment plan, you're probably looking at around about a 50% reduction. And I've got quite a lot of stats in my practice on this, that pre-dental monitoring, we were averaging, 20, 24 appointments, something in that region for a braces case. And we're completing cases in 7 or 8 chairside appointments now. So, it's a phenomenal freeing up of chairside time. So much so that you're sometimes struggling to fill the diary up, which is incredible, really.
Wow, that's just amazing. So, tell me more, Murtuza. What does that mean in terms of practice efficiency and your golf games on the weekend?
I think it's done stuff to the practice that you could never possibly imagine. Stuff from as simple stuff as not needing to make as many phone calls, not needing as much stationery, not needing to do as much sterilizing, to something even more radical as needing a smaller premises, needing less clinical staff. You look at every aspect of the practice, and I think dental monitoring has pretty much changed that. I have not actually had to ask any of my staff to leave, but what's been happening in my practice is, as part of natural staff coming and going and movement on, I've been able to reduce my clinical staff. I had at one point 4 dental therapists. I'm now working with 1 dental therapist, and I have double the caseload. So, the numbers and the effect on profitability is just phenomenal, really.
That's just inspirational. Now, I want to ask about the staff delegation. A few months ago, I was talking to you, Murtuza, as well, and I asked you, how much do you trust your staff? Because I remember in one of your lectures, you said, there's someone putting on the attachments, someone taking the impressions, someone doing that. It's almost like, you're just the director behind the scene, and they're all the actors doing all the work. And this is the exact analogy that you use when we're doing our podcast together. So this is what I want to. How important is it to put enough trust in your staff and delegate in order to increase your efficiency and to make that work?
Well, as you can see from the camera, I'm hardly a good-looking guy, so it's better that I'm behind the camera and directing than in front. So, for me, my role is diagnosis and planning and directing. So it's at least 3 or 4 years ago that I stopped having a treatment list now. So my role is not to put my fingers in patients' mouths. My nurses are able to take scans. My staff are able to discuss treatment plans and discuss treatment costs, and treatment coordinators are better than me at discussing that kind of stuff. And my therapists are able to put attachments on and do all the retainers and all the other thing that a patient needs in their journey. So in reality, my staff are the most important part of my practice, as my other esteemed colleagues have said. And so essentially they run the show. I just turn up and do some treatment plans and do some clin checks. And these days I do most of them outside of the practice wherever possible. So I think the staff element is absolutely critical to the practice. And I think I would add that the way to get the staff on board is to get one member of staff who's really infectiously addicted to dental monitoring. And when you get that person on board, then they kind of infect everybody else. And I hate to use that word in COVID times, but they infect everybody else with their enthusiasm, and then it spreads through the practice. And I think that's what's been particularly useful in my practice.
I believe that what you just said right now was music to Martina's ears. I mean, Martina, one time you said something that was really interesting, because I see you as someone who is really good at delegation. And at the same time, you said that I asked you, what is your biggest weakness? And you told me delegation. And that's where I was confused. So can you tell me more about it?
Okay. Well, I think, I'm definitely getting better at delegation. And the busier and busier we get, you realize that you have to delegate. And I've had this very kind of rapid journey the last few years, where I've gone from being a general practitioner with a DEM plan list and doing fillings and extractions and root canal treatments, to gradually building this team around me where basically I'm just doing the dentistry I love. And I'm doing 3 days a week, Invisalign only. I mean, today I just did consults all morning, and my nurse was laughing with the patient because she needed an upper second molar extracting. And my nurse just said to the patient, "Oh, you don't want us swinging off your teeth." And it's like, now I'm just doing the dentistry I love. I'm just doing the Invisalign. I'm creating more and more space in my diary for that, to read the dental monitoring. And I've got a team of associates around me who are able to, I can delegate all that other stuff to. So it's about being able to empower other members of your team to do the dentistry they love. I've got someone who's an endodontist. Well, they're better at it than me. Let them do it. I've got an oral surgeon. Let them do the extractions. And I even have a dentist now who just does all my attachments and IPR for me. So I'm in an incredibly fortunate position that I'm able to do just, cutting down to 2 days a week now, doing the dentistry I really, really love.
Absolutely amazing. More time to do what you love the most. And I want to bounce back to you, Keely, because we're talking about delegation, and this is something maybe that you're not there yet as an associate. So I'm just wondering, all this technology that you're investing in, is it causing you a lot of extra work because you're handling all of this on your own?
Good question. So I am sort of a one-man band at the moment, and I listen to Martina, and I'm like, I can't wait to be able to just do what I want to do, but I'm still doing the extractions and all of that stuff. But yeah, I am looking after my own dental monitoring account at the moment, so I do pretty much everything. It's still saving me a lot of time. So even doing it all myself, I'd say, is fine. Probably if my patient numbers increase too much, then I may, need a little bit of help. But I would never have been able to see those high numbers in practice without monitoring anyway. But I am starting to get my nurses to sort of take the first scans with the patients and things like that. So I am fortunate that in my practice, everybody is very supportive about the monitoring. My nurses think it's really cool. So they chat. I hear them chatting to the patients about it around the desk and things like that. So yeah, but I'm not there just yet. With Delegate and everything, but it's been fine so far.
You're still young and energetic. You can do it all alone now.
Exactly.
Now, Anshu, I have one last question to you, because I just love how much you emphasize on, how much value the patient should perceive from the early beginning in order to increase the compliance, in order to increase the quality of the treatment. So can you give us one advice on how to train your team, and how do you script the whole pitch from the beginning?
So I think it's really important that the team know what the platform looks like, so that they can see what so should I say the whole team know what the platform looks like. So the people that are daily monitoring the dental monitoring, that the team, like on reception and what have you, they understand what we're looking at and the feedback that we're getting from the patients, so that they can tailor their answers and their scripting and their conversation around how the platform actually works. Because it's very difficult to talk about dental monitoring to a patient if you don't understand what they see on their phones when they get their messages back, or what we're looking for when we're looking at their scans. So I think that's really, really important. I think it's really important that everyone has a go at scanning their own teeth, so that they understand how that is for the patient. So when the patient struggles, they know which way the retractors go in. They know how the retractors attach to the scan box. They know where they put their phone in. They know where they download their app from and what the app looks like. So I think that's been really important in everybody's journey. And I think that more importantly, the team need to understand what the value is to the patient, not what it is to us, but what it is to the patient, because that's why we're doing it at the end of the day, isn't it? Because we're doing it so that the patients feel like we are more engaged in their journey, and consequently they themselves are more engaged in their journey. And so I think once the team understand the value of us being able to interact with the patients on a weekly basis over their scans, and be able to tell them when they've got poor oral hygiene, to let them know when they've lost their attachments, to let them know when they've got the wires out the brackets, I think it really helps the team to completely get on board with it, and to be willing to be helpful to the patients and speak from a position of authority as well.
Absolutely love what you just said. It's all about the patients, especially when we talk about the new generations, because they used to say before the baby boomers, it was enough to go to the doctor, and there was this, they call it the white effect psychology. They used to trust the doctor, whatever he says. But today they are more skeptical. They are more about convenience, affordability, and the patient experience. And this is so important for success, and not only the end result. Now, conscious of the time, I think we're at the end of the session. So I want to ask our speakers if you can give practical tips to all the audience who are still hesitant about embarking on this new journey. Maybe we'll start with you, Murtuza.
I think for me, it's about not being afraid of the technology, understanding and looking at people like ourselves who are already using it and saying, look, there's without a doubt the benefits are there. So really just diving in, changing your mindset and saying, this is going to make my practice better, and going for it, not hesitating, but also not trying to reinvent the wheel. Look at all the people that are already doing it, ask questions, get help from the dental monitoring team, and just go for it.
Awesome. Martina, would you like to share a few last words on that?
Yeah, I think it's just about helping your team understand what the benefits are going to be, not only for patients, but for them as well, in terms of, the saving in terms of clinical time, being able to give our patients that experience that they might not get elsewhere. And they really do think it's cool. And this is a generation now that are used to smartphones as normal, and, who are used to Zoom now and all these kind of things. And they expect this kind of technology. If you're not offering it, you're going to end up lagging behind, and you need to kind of stay in front and be that go-to practice where you can get that really rounded, super patient experience.
Awesome. Anshu, I'm a dentist who thinks that my patients are just happy with the way things are now. What would you tell me?
So I would say that it's very easy to explain the value of dental monitoring. And I would say that actually the most important thing is to not prejudge the patients that will and won't get on with it. Because I think initially when we talked about this with the team, they were all like, oh, I don't think the older people will want to do that. Well, come on, these older people have learned how to use Zoom. They've learned how to shop on Amazon. They've had a massive steep learning curve, and technology is still a novelty and an excitement to them because they've learned to do so much in a short period of time. So I think it's really important to be willing to spend the extra time with the people that you think need it. And that's not always the people that you would expect to need it, and get everybody on board with it, because once the patients understand it, they love it. And so I think time is important, time to get people on board with it and to have an open mind as to who will and won't be willing to use it, because most people are willing to use it.
Absolutely, I agree with you. Now, last but not least, Keely, I'm an associate. I'm super motivated. I want to grow in my journey, but my principal is really narrow-minded. How can you motivate me to start to embark on that journey?
So exactly like I said earlier, I would say don't be limited by your practice. Start to kind of think of yourself as your own brand and invest in yourself. And if dental monitoring, is the kind of service that you want to offer, don't be afraid to invest in it. You will see the benefits financially and all the other benefits as well. And I would say don't wait. It's easy to think, well, actually, I don't need monitoring right now because I haven't got, all of these patients going through treatment. But it will actually help you to grow. So I would say, even if you are new on your Invisalign journey and you have only got perhaps a couple of cases, just start right away with things like monitoring, because as we've all said, it's an amazing service to offer to your patients, and it will help you to grow a lot quicker. So that's what I would say.
Be your own brand. I love that. So I think we reached the end of our session. I want to say thank you so much for every speaker that is on this panel. I think it was absolutely amazing. I hope that the audience got a lot of golden nuggets from it, and I'm sure they did. And so one last time, thank you so much for your input. Thank you so much for your time. And for all the audience, I hope you enjoyed it. And please, if you have any question, do not hesitate to go and visit us on the virtual booth, where we'll be happy to answer all of your questions, of course, along with the speakers. Thank you so much.
Thank you.
Thank you.
Thank you.